Hello everyone, you're watching Physio Classroom channel, and in today's video we are going to learn the indications and procedure for performing median nerve mobility test. Now, median nerve mobility test is indicated when the therapist has any suspicion about the involvement of the upper cervical nerve roots, or in conditions like pronator teres syndrome or carpal tunnel syndrome where there are chances of the median nerve getting compressed. Also, if the patient reports that he or she is suffering from any problem or symptoms in the anterior shoulder, arm and forearm, the median nerve mobility test is recommended. So today I have with me my postgraduate student Anjali Chauhan, who is going to help us with the practical demonstration of the median nerve mobility test. So we are going to learn the performance of this test in 6 important steps. So in step 1, the side on which we are going to perform the test is going to remain near to the therapist, and the patient is going to be positioned at the edge of the couch. So if I'm testing the median nerve mobility on the left side, so the left shoulder needs to remain as near to the edge of the couch as possible. The step 2 is positioning of the therapist. So the therapist is going to stand in the stance position or a step standing position, and the near hand of the therapist, so if I am checking on the left side, the left hand is going to bend around the knuckles and it is going to go right underneath the scapula, and the forearm is going to remain perpendicular to the couch. Now this hold is important because we do not want any scapular elevation to occur when we start performing the shoulder abduction movements. And also, by keeping the forearm in this position, we can apply the depression forces to further tension the median nerve at the level of the brachial plexus. So now from here, the step 3 is performing the movement at the level of the shoulder joint, which are shoulder abduction up to 90 to 100 degrees and shoulder external rotation. Now once we move the shoulder into abduction and external rotation, the therapist can use the thigh to support the arm so that it does not falls down into horizontal extension. Now in the 4th step, the therapist is going to grip along the patient's hand using a pistol grip. So what I'm going to do is I'm going to wrap my fingers around the fingers of the patient, and I'm going to use the index finger to keep the thumb into abduction and extension position. Now this is so because I want to tension or stretch also the recurrent motor branch of the median nerve. Now from here I am going to produce forearm supination and wrist and finger extension. Now the 5th step is the performance of the elbow extension movement, and therapist is going to feel for the resistance offered to this movement and compare it with the normal. Also, the therapist is going to ask the patient for the reproduction or exaggeration of the symptoms in the problematic region. Now the 6th and final step in performance of this test is structural differentiation. Now therapist needs to structurally differentiate between the involvement of the neural structures and the non-neural structures. Now let's understand how structural differentiation is done. Now structural differentiation is made by altering the nerve mobility or tension in the problematic region without altering the musculoskeletal tissues. So let's say for example, this patient is having complaint of wrist and hand pain. So in this case, what I'm going to do is I'm going to move the neural tissues by moving a distant part. So let's say for example, I'm going to ask the patient to perform neck side flexion movement while keeping the wrist and hand stationary. So if this movement exaggerates the patient's symptoms, then we can confirm a neural involvement. Whereas if the performance of the neck side flexion does not alter the patient's symptoms, then we can consider that the neural tissues are not the primary structures that are involved, and we have to look for the treatment of the musculoskeletal structures. So now what the physiotherapy students needs to understand is that structural differentiation is always made by moving the neural structures from a distant region or site. So let's say for example, if the patient was having pain in the neck or shoulder region, so how we are going to structurally differentiate in this case is by releasing the wrist and finger extension movement. Now again, if releasing the patient's wrist and finger extension alters the patient's pain symptoms in the head and neck, then again we can confirm it as a neural involvement. Whereas if there is no change in pain, then we have to consider another source of pain, which can be a joint or a muscle problem. So this was all about the indications and the 6 important steps for performing median nerve mobility test. Now there are many advanced variations for performing this test depending on the patient's condition, which we will be covering in our upcoming videos. Do keep motivating us with your comments and feedback. Keep learning, keep sharing, and stay connected.